as a parent, just having an understanding of how development occurs. So it starts with extension, and flexion. So when your baby is on its tummy, if you're looking for, can they lift their head up by about 4 months? The hallmark is, can they lift their head up? And when they do so, do they have a symmetrical trunk? Like, are they activating muscles on both sides evenly? So you should see like a straight spine, head lifting. Are they lifting their head up against gravity on their stomach? And when they do so, are they stabilizing? Like, is their trunk stable? Are they able to kind of move their arms, legs freely of their trunk and lift their head up? And is it symmetrical? I think at times often there are imbalances. One side is more active than another side when there is something that needs to be addressed. So it's looking at both sides of the body, that symmetry, that alignment. Can they do that by 4 months? On their back at 4 months, anybody that does yoga, it's kind of like that happy baby pose.
Oh, yeah.
They're grabbing their feet. Are they able to stabilize on their back and lift their arms up, lift their feet up, and kind of start to play with touching their feet? And can they lift their head up a little bit? If you go to pull them up, is their head staying back, or are they able to actually do that chin tuck? So really by 4 months, you're looking for that good control on their back, on their stomach, for flexion and extension. So flexion is here, extension is lifting up. When they sit up, do they have a vertical spine? Are their legs out in front of them as opposed to sitting? Are they able to stabilize through their trunk and move their body to reach for toys and be upright, where their core is stable and they can move their extremities more freely? And so if you're not seeing that, or they kind of last in that phase where they're like really relying on their arms to keep themselves up, like that's kind of a sign, like, okay, maybe we need to address something here. And then another, like, I think the third hallmark within the first year is getting to standing. So usually by 10 months, babies are pulling to stand. And you'll see them kind of like start to squat down to pick up toys. And what you're looking for there is, do they have vertical tibias? And so you're looking at that bone between the ankle and the knee joint. Is it basically popping straight up from the floor? I think at this stage in my life, it would be a miracle if I could get mine. The babies have all the mobility and they can do it. So, you're looking for that by 10 months, and just having, I think, alignment and symmetry. Is your baby moving the same on both sides? Are they aligned? Are you seeing things? I think outside of all of those, from a gross motor standpoint, there are primitive reflexes, which again, there are whole courses on this, which should be starting to integrate by about 4 to 5 months, like when babies start rolling over and everything. And if those stay beyond a certain period of time, that's also another sign you should seek PT.